I don't know too much about the history of Sandpoint, other than it was a Naval Air Station. My first encounter with Sandpoint was a long time before I got there. I was stationed at Pier 91, and at that time it was a naval station in 1962. And I was stationed at the clinic as a hospital corpsman, 3rd class, and within months after I got there, they transferred all but 2 physicians and 10 hospital corpsmen to Sandpoint to make it essentially a regional outpatient clinic for Seattle. So it became the base hospital, if you will. From Pier 91, I went to the Fleet Marine Force, and then I came back. And after I got commissioned, I was I was stationed again at Whidbey Island, and that had another episode of experience with Sandpoint, because we used to fly down here for meetings, and we'd land helicopters on the old tarmac, which was kind of interesting. I came to Sandpoint to be stationed there as the executive officer of the clinic in 1979. And I relieved Ken Schaefer at that time as a lieutenant commander. And it was kind of interesting. Bob Surface, Captain Bob Surface, was the commanding officer of the clinic. And it was, of course, regionalized with Bremerton, the Regional Medical Center at Bremerton. Captain Ron Prue was the CO there. So he was my reporting senior at the time. Well, actually, he wasn't. Bob Surface was So I spent 2 years as the executive officer. My primary duties was to keep the clinic running, keep answering complaints and that type of thing, answering correspondence, personnel matters. I was the custodian of classified information and those types of things. I had at that time another MSc officer who was I actually had 2 other MSc officers. One was the pharmacist, Ben Dodge, and the other one was, I forgot his name. I was young Lieutenant J.G., who was my supply officer, fiscal and supply officer. So it was kind of an interesting thing. The one thing that did happen while I was XO was I had to retire Alan Bloom. And that was the first time I had any experience with retiring somebody and retaining them on active duty, which required a whole lot of paperwork back and forth between us and Navy Personnel Command. And that was kind of interesting. And Alan stayed for a while. In 1981, Bob Surface decided he was going to retire. And it was a decision of the Surgeon General to fleet me up. So I became the commanding officer. I relieved Bob, and I can't remember, it was probably around the 1st of July. I can't remember the dates exactly. That's a long time ago. And I became the CEO of the clinic. Bob retired. Vern Sandel, so at that time was a commander, Medical Service Corps, came to be my XO. Well, actually, he was a lieutenant commander when he came to be my XO. Vern went on from here to Rota, Spain. Naples, Italy, I think it was, as the XO of the hospital. I don't keep in touch with him. I don't keep in touch with very many people. But anyway, within weeks after I became the commanding officer, a project that I had been working on as the XO and with Bob Surface on the renovation of the clinic became funded. So they moved me out of the clinic into Building 9, which was a barracks at the time. Most of my hospital corpsmen lived in Building 9 on the 1st and 2nd floors, and they put me on the 3rd floor with my command master chief, my XO, and my secretary, and a couple other people. We also took care of the COM-13 functions for the Naval District, the burials at sea, those types of things. Paying claims for civilians' hospitals, and the administrative functions of the medical department for COM-13. So it was kind of interesting from that respect, because I had to walk back and forth to the clinic at least 10, 12 times a day, which was kind of a pain in the ass, but it was okay. The two significant things that occurred while I was commanding officer. We instituted a family practice model of patient care, which means that we enrolled families with a specific provider. And every time that they came to the clinic, they would see the same provider, unless they were referred for some specialty care, either Bremerton or downtown or whatever. And that was a monumental project. That took over a year to actually put together. We sent letters to every beneficiary that we had addresses on, that we had medical records on, and there was a lot of them. That's about we saw about 45,000 outpatient visits a year with the 10 docs and 2 PAs that we had. Had actually one active duty naval nurse, and we had some civilian employee nurses, federal civil service. So it was kind of an interesting project. The other thing was, the significant one was the renovation of the lab, the x-ray, and just the clinic in general. And a new pharmacy, which was kind of interesting. But that took almost a year and a half before I got to move back into the clinic. And at that time, they put me up on the 3rd floor. So I was there for the remainder of my time, and I retired from Sandpoint on the 1st of July, 1983, after being the CO for 2 years. I don't even remember who the CO of the station was at that time, to tell you the honest God's truth, Ron. I know that Ted Lewin, Commodore Lewin, was the district commandant at the time, and his office was there at Sandpoint too, and that was kind of interesting too. I think that's the first time they brought the Commodore back in terms of a rank. They were always Rear Admiral lower half. So didn't do anything real outstanding or anything earth-shaking. What happened while we were there? I was relieved by Commander Gordon Carpenter on the 1st of July, 1983, and I retired. I do have one that occurred just before I retired. In fact, probably the last official act and the last time I really signed anything that took effect was locking a young kid up for espionage, or investigation of espionage. Young 3rd-class hospital corpsman. Showed up in our clinic on a Sunday afternoon and was kind of had in a meltdown, and my chief of the day called me at home. He said this, and he told me who he was, and I told him, keep him there, and I'd be there in half an hour, because it took me that long to get from Kirkland to Sandpoint. I told the chief of the day to call the Naval Investigative Service, and they had their resident on call in. This was a Sunday afternoon. I didn't get home till probably about 11 o'clock that night, but apparently this young fellow had, and they found out he wasn't really who he said he was through the investigation. He had been dishonorably discharged from the Marine Corps under another name, enlisted in the Navy, and was aboard of my guided missile frigate as a 3rd-class hospital corpsman before he came to us. And he was with us relatively new, within 5-6 months, and did his job great as a hospital corpsman. But while he was on the frigate, he absconded with the microfiche of the weapons systems on the frigate. He had found the microfiche sitting on the XO of the ship's desk, and took them, which was kind of later on turned out to be an interesting story too, because there was actually 3 people relieved of their commands after that line type, because he had the fish, and apparently had set up an appointment, according to the Naval Investigative Service, with a foreign agent. I don't know who, whether it was Chinese, Russian, or whoever, in exchange for these microfish for money. And he was, he was a third-class petty officer who was allowed to live off the base and that type of stuff. He was living in an apartment in town. They turned that upside down. In the meantime, I was responsible for keeping track of this kid. But preliminarily, I didn't want to lock him up in the brig. So we kept him in the clinic on the third floor in a quiet room and had a watch on him 24 hours a day.
Really?
Yeah, all hospital corpsmen, second class and above, stood a watch on that kid for, it wasn't very long, maybe 3 or 4 days, but it was kind of an interesting thing. I understand later on that he was actually referred for a general court-martial, but just the fact that we had him and didn't know that he had been discharged from the Marine Corps was shocking to me. I thought Marine Corps and Navy fingerprinted everybody that came in, but obviously somebody didn't run them, because I never did get the result of his court-martial or anything of that type, but he was referred, I know, for a general court-martial. That was the one little secret thing that I haven't told a heck of a lot of people about, Ron, and that's 30 years ago. I would have to tell you the story about how I got to be coming to Sandpoint. Okay. I was in the Bureau of Medicine Surgery for about almost 5 years, and I was the Deputy Director of Health Benefits Division.
That's in D.C.? In
D.C. Yeah. And the last year that I was there, the Surgeon General and Chief of the Medical Service Corps asked me if I would be willing to go out to Bethesda, to the Naval School of Hospital Administration, and set up a course in Patient Services Administration. And I said, yeah, I'd be willing to do that, but I really need to get back to Pacific Northwest. My father-in-law was relatively ill, and almost seriously ill, and we needed to get back out here. But they said, well, if you go out there for a year, we'll send you out to the Pacific Northwest. So I got transferred to the Naval School of Healthcare Administration at Bethesda. Harry Coffey, Lieutenant Commander, and myself wrote the course, a 5-week course for young ensigns and JGs who want to be patient affairs officers in naval hospitals. Covered all personnel matters and those types of things, retirements, disability system, those types of things. Everything that a personnel officer would do in a naval hospital, plus the administrative, medical administrative type things. So I'd been there a year. I was coming up on a year, and I taught the first 2 classes, and my detailer called me and said, we're going to leave you there. We've adjusted your PRD. You're not going to be leaving there for another 3 years. And I said, wrong. I have to get back to Pacific Northwest. I just have to go home. Of course, all my relatives were out here. We had nobody on the East Coast, and I spent 6 years there. So I tendered my letter of requesting retirement. And at that time, my commanding officer, Captain Bill Otten, was making the tour of all the training facilities on the East Coast, and he was up at Newport, Rhode Island at the time, and so the XO wouldn't forward my retirement request until Captain Otten came back. I said, that's fine. I just had to, I had to submit it while he was gone in order to do the 6-month thing, and it was kind of interesting. So when Captain Otten came back, I happened to be in the medical library, doing some notes and things and getting ready for class, because I also taught in the senior medical officer course too, fitness reports and things of that type. He came in and said, what's going on, Bobby? Why am I getting a letter like this? I said, well, and I explained the situation to him. He said, would you give me a day or two? And I said, sure. Well, it wasn't 6 hours later. He came to find me in my office and said, we're going to send you to Sandpoint, the Regional Medical Clinic, as the XO. Is that okay? I said, for that, yes, you can tear up my letter. So that's how it happened. That's exactly how it happened. It was kind of interesting. So my tour at Sandpoint was more of coming home than anything else. I'd been stationed in the Pacific Northwest twice before, Pier 91 and the Naval Hospital, Whidbey Island, and we just loved it here. And besides that, Pam's folks, my father-in-law, lived in McMinnville, Oregon, which was like 200 miles away. So it was like coming home, and I enjoyed my tour here. I really did. When my tour was starting to end, and by that time I had 26 years in the Navy, they wanted to send me to Naval Hospital San Diego as the Chief Patient Affairs. I talked with my detailer, and what he told me was they were not sending commanders as COs or XOs anymore. Yet I was relieved by a commander, and that I was going to go back to be chief patient. I told him, Ron, right off the bat, Milt, and my detailer was Milt Benson at the time, that I was the number 2 patient affairs man in the world. What the hell do I want to do going back to be a chief patient affairs again? I said, I don't need that. Send me to be an administrative officer at a regional medical center. I don't care, but not as a chief of division. He said, can't do it. So I decided it's time to retire. Needs of the Navy no longer coincide with my personal needs. It was time to go. And so I submitted my letter. Got all kinds of phone calls. Lou Angelo at that time was the chief of the Corps, chief of the Medical Service Corps. And he personally called me and asked me what was going on, and I explained the situation to him. I needed to be in this area, and wanted my kids to finish high school here and that type of thing. And so he understood, and they forwarded my letter to Chief Purse, and I retired. And I haven't regretted a minute of it.